When you check your blood pressure, you're staring at two numbers, but most people have no clue which one is quietly putting their health at risk right this second. And that confusion isn't harmless. Your doctor might have told you your numbers are manageable without ever explaining that, depending on your age, one of those digits could be silently damaging your arteries far more than the other. You got a reading. You never got a system to understand it. Imagine this. 1 week from today, you sit down, wrap the cuff around your arm, and for the first time in years, those numbers actually speak to you, not as random digits, but as a clear story about your heart, your blood vessels, and your real risk level. Right now, today, you'll know exactly which number needs your attention first. You'll understand the specific daily habits that directly target it. And you'll learn one hidden variable that could make every other piece of advice in this video useless for your unique situation. Your blood pressure reading is a two-channel signal. Most people only hear static. That's what we're building together. Not vague wellness tips, but a structured, evidence-based system to decode both numbers and take action. But right now, most of you have been measuring your pressure for years without truly grasping the core difference between the top and bottom. I don't blame you. No one ever broke it down clearly. Your physician said it's high, wrote a prescription, and sent you on your way. The top number and the bottom number come from completely different biological events. They carry different risks, and they require different responses. There is one crucial factor that decides which of your two numbers is your most urgent threat at this stage of life. I'll reveal it halfway through this video. If you click away before that point, everything else I share will only be half as valuable to you as it could be. Let's start with the basics. When your heart beats, it squeezes and pushes blood into your arteries with force. That peak pressure, the moment of maximum push, is your systolic reading, the top number. Then between beats, your heart relaxes and refills. The pressure in your arteries drops to its lowest point. That's your diastolic reading, the bottom number. So when you see 120/80, here's what that actually means. 120 millimeters of mercury at the moment your heart fires, and 80 when it rests. Two numbers, two snapshots from one cardiac cycle. And critically, two very different windows into your cardiovascular health. Here's what to do before anything else today. Take your blood pressure 3 times in a row with a full minute of rest between each reading. Write down both numbers every time, then average them. That average is your true working blood pressure, not the single half-asleep glance you took last Tuesday morning. Most people take one measurement, see a number, and either panic or shrug. Neither reaction fits based on one data point. The truth lives in the average of 3 proper readings. Write those numbers down. You'll need them in about 4 minutes. Think about what we just established. One biological process, 2 snapshots. One tells you about effort, the other about recovery. Blood pressure is unusual that way. It gives you a 2-channel signal when most vital signs give you just one. The question is whether you know how to read both channels correctly for your age and your unique body. Now let's talk about the top number, systolic pressure. After age 50, the biggest driver of a rising systolic reading is stiffening arteries. Your arteries, especially the large ones like the aorta, are lined with elastic fibers that let them stretch when your heart pumps and bounce back between beats. Over decades, those elastic fibers break down and get replaced by stiffer collagen tissue. The artery becomes less like a flexible rubber hose and more like a rigid metal pipe. Arteries don't age on a calendar. They age on your lifestyle. This isn't sudden, it's gradual. Each year, you lose a little more elastic fiber and gain a little more collagen. The process speeds up under chronic stress, with persistently high blood sugar and when you skip regular aerobic exercise. What you eat, how you move, and how you sleep aren't side notes. They directly shape your arterial walls every single day. Consider a man I'll call James, 64 years old. He came to me with a systolic reading of 162 and a diastolic of 78. His own doctor had told him the bottom number looked fine. What no one explained was that for someone his age, that top number alone represented a significantly higher risk of heart attack or stroke, regardless of what the bottom number was doing. He'd been watching the wrong channel for years. That's the kind of gap this conversation is designed to close. When the arterial wall stiffens, the pressure spike during each heartbeat becomes more dramatic. There's no flexibility left to absorb the mechanical force. So the systolic number climbs, sometimes a lot, even when the diastolic stays perfectly normal or even drops. This is why isolated systolic hypertension is the most common form of high blood pressure in people over 60, and it carries serious, well-documented consequences, meaningfully higher risk of heart attack, stroke, chest pain, and progressive kidney damage. Research tracking patients over 20 years showed that every 10-point increase in systolic above 140 was linked to a 15 to 20% jump in cardiovascular events, not the bottom number, the top number, the one doctors used to tell older patients not to worry about too much. So what can you actually do about arterial stiffness? Two things with strong, consistent evidence behind them. First, potassium from whole foods. One whole avocado contains roughly 900 milligrams of potassium, about 20% of what your arterial smooth muscle needs each day to function properly. Fatty fish like salmon, mackerel, and sardines provide potassium along with omega-3 fatty acids, which multiple clinical trials have shown directly improve arterial elasticity. Sweet potatoes, white beans, cooked spinach, these aren't exotic or expensive foods. They're ordinary foods that most people simply aren't eating in sufficient quantity. A medium sweet potato delivers over 500 milligrams of potassium. A cup of cooked white beans delivers over 1,000 milligrams. These numbers matter because the average dietary potassium intake in men over 50 typically falls well below the recommended 700 milligrams per day. Most men are getting barely half of what their arterial tissue actually needs. The mechanism isn't complicated. Potassium helps your arterial smooth muscle cells relax. Relaxed muscle means lower systolic pressure. This isn't a pill you buy, it's food you eat. And the difference between someone who consistently meets their dietary potassium needs and someone who chronically falls short is measurable in blood pressure points over months, not years. Second, consistent cardiovascular exercise. 30 minutes of moderate aerobic activity, 5 days per week, has been shown in repeated studies to reduce systolic pressure by 8 to 14 points over a 12-week period. That's clinically comparable to what many low-dose medications achieve. Not because exercise is magic, but because your arteries literally become more elastic with regular aerobic load. Use it or lose it applies to your blood vessels exactly the same way it applies to your muscles. The type of exercise matters less than the consistency. Walking, cycling, swimming, rowing, any sustained moderate aerobic effort produces the adaptation. The key phrase is moderate intensity. You're not trying to sprint. You're trying to sustain a pace where your breathing is elevated, but you can still hold a conversation. That range, held consistently 5 days a week, is where the arterial remodeling happens. Here's a simple image I want you to hold on to. Think of a brand new garden hose. Squeeze it. It expands, it bounces back cleanly. Now think of a hose left in the sun for 15 summers. Squeeze it. It barely moves. It's lost its give. That's your aorta after decades of low dietary potassium, chronic unmanaged stress, and a sedentary routine. The goal of everything in this protocol is to give that hose some of its flexibility back. And here's the part that gives most people genuine hope when they fully understand it. The process of arterial stiffening is not a one-way street. Research from the last decade has demonstrated measurable improvements in arterial elasticity in patients who adopted consistent aerobic exercise and dietary intervention, even in their 60s and 70s. You are not simply trying to slow the damage. You are potentially reversing some of it. It is possible. The research is unambiguous, but it requires consistent input, not occasional effort. Now, before we move to the bottom number, I told you there's one critical factor that decides which number is your biggest threat. We're almost there, but I need you to understand the diastolic picture first, because without that context, the factor I'm about to reveal won't fully land. Here's where blood pressure conversations most commonly fall short. The diastolic number, the bottom one, tells you about the pressure your arteries are under during the rest phase between heartbeats. When that number is chronically high, your vascular system never fully decompresses. There's constant, persistent tension in the arterial walls. Even when your heart isn't actively contracting, the system is always partly under load. Now, here's what makes this particularly dangerous, especially for people under 50. Persistent elevated diastolic pressure puts ongoing mechanical stress on the walls of your largest blood vessels, including the aorta. Over time, this chronic stress weakens the arterial wall from the inside. The layers of the arterial wall, normally tightly bonded and structurally sound, begin to show fatigue under the relentless pressure. Think of bending a metal rod back and forth repeatedly. Each individual bend may not break it, but over thousands of repetitions, the metal fatigues and the structural integrity is compromised. And this creates one specific serious risk that doesn't get nearly enough attention in general health conversations: abdominal aortic aneurysm. An abdominal aortic aneurysm is a bulge that forms in the weakened wall of the aorta as it runs through the abdomen. It develops slowly over years. It's almost entirely silent. No pain, no obvious symptoms. In most cases, you could have one developing right now and feel completely fine. And if it ruptures, survival rates drop below 50% even with immediate emergency surgery. This condition disproportionately affects men. It disproportionately affects men who have spent years with elevated diastolic pressure, and it is almost entirely preventable when identified and managed early. I want you to sit with that for a moment, not to frighten you, but to motivate you, because motivation is only useful if it leads to the right action. So what specifically targets the diastolic number? Two interventions with the most consistent evidence: stress management and sleep. Before you mentally file those under soft advice, here's the mechanism. Chronic psychological stress, the low-grade background kind that most people over 40 carry, activates your sympathetic nervous system continuously. When that system stays chronically active, your body maintains elevated vascular tone. Your blood vessels stay partially constricted, even at rest, even during sleep. The result is a diastolic number that stays high around the clock, not just during stressful moments. A study published in the Journal of the American Heart Association followed participants for 4 years and found that those reporting high levels of persistent occupational stress had diastolic readings averaging 6 to 8 points higher than their low-stress counterparts, independent of diet, exercise, and medication status. 6 to 8 points from stress alone. That's not a small number when we're talking about sustained arterial wall pressure over years. The practice here is not vague mindfulness. It's any structured daily activity that activates your parasympathetic nervous system for at least 20 minutes. Slow breathing exercises, a walk without your phone, deliberate stillness before bed. Whatever the form, the physiology is the same. You're shifting from sympathetic dominance to parasympathetic dominance, and your diastolic pressure will respond. And sleep 7 to 9 hours consistently. People sleeping under 6 hours per night show consistently higher diastolic readings than those sleeping 7 or more. Sleep is the only window in your 24-hour cycle when your parasympathetic system fully dominates. Cut that window short, and you cut short the only natural decompression your arterial system gets. Your arteries need those hours. They use that time to restore tone, regulate inflammatory signals, and reset vascular sensitivity. Short-changing sleep isn't just a fatigue issue, it's a blood pressure issue. For someone in their 40s with a diastolic reading that climbs above 90, consistent sleep may be the single highest leverage variable in the entire picture, more impactful in some cases than dietary changes alone. Let me bring the full picture together before I give you the critical factor. Potassium-rich food and aerobic exercise for the systolic number, stress reduction and consistent sleep for the diastolic number. That's a complete protocol, not a partial fix. It costs nothing except consistency and intention. All right, here's the factor I promised you, your age. If you are under 50, elevated diastolic pressure is your primary concern. The persistent wall stress, the risk to your aortic integrity, the vascular fatigue from chronic load. These mechanisms are most consequential in younger arterial tissue that still has tone and elasticity, but is being chronically overworked. If you are over 50, dominant systolic elevation becomes your primary concern. Your arteries have already lost some of their natural elasticity. The pressure spike during each heartbeat carries greater mechanical impact on a stiffer system. The cardiovascular risk, heart attack, stroke, kidney damage scales more directly with systolic elevation in midlife and beyond. This isn't a matter of opinion. This is the medical consensus shift that has occurred over the last 2 decades. For a long time, physicians considered diastolic pressure more clinically significant. High diastolic was the serious concern. High systolic in older patients was often described as an expected feature of aging, something to keep an eye on, but not the primary target. That view has been completely overturned by large-scale, long-term outcome research. Current clinical guidelines now place systolic pressure as the primary driver of treatment decisions for patients over 55. Not because diastolic stops mattering, but because systolic in that age group more accurately predicts cardiovascular events. If your doctor hasn't had this specific conversation with you, this video is that conversation. Now, about medication, because a significant portion of the people watching this are currently on blood pressure treatment, and I want to address that directly. Blood pressure medications, ACE inhibitors, beta blockers, calcium channel blockers, diuretics are effective. They lower the numbers. They reduce cardiovascular risk for many patients. They are absolutely the right tool when clinically indicated. But here's what the research consistently shows. Medications reduce cardiovascular risk. They do not eliminate it. Even patients with well-controlled blood pressure managed pharmacologically retain measurably higher cardiovascular risk than people who have never had hypertension at all. The gap between controlled with medication and naturally within normal range is real and clinically meaningful. That gap is partially, but significantly, bridged by the lifestyle interventions we discussed today. Medication and lifestyle are not alternatives. They are a stack. Both together produce better outcomes than either alone. Medication treats the reading, lifestyle treats the reason. If you're on blood pressure medication and not addressing the 4 lifestyle inputs, potassium, aerobic exercise, stress management, sleep, you're treating the output of a system that continues to be driven toward hypertension by your daily inputs. That matters, and closing that gap is entirely within your reach. Here's the complete daily protocol in practical terms. In the morning, within the first 2 hours of waking, eat 1 potassium-rich food: avocado, banana, sweet potato, sardines. Choose one. This isn't a dietary overhaul. It's one addition that your arterial tissue will use directly. If you want to go further, pair it with a handful of leafy greens. Cooked spinach in a morning omelette contains more potassium per serving than a banana, and it adds almost nothing to your meal prep time. During the day, 30 minutes of aerobic movement at moderate intensity. You should be able to speak in short sentences, but your breathing is noticeably elevated. That zone, held consistently, is where arterial elasticity improves. If 30 minutes feels like too much right now, start with 15. 2 15-minute walks produce nearly the same vascular benefit as one 30-minute session. The biology doesn't care about the format. It cares about the sustained aerobic demand. In the evening, 20 minutes of deliberate nervous system decompression. No screens. Slow, controlled breathing, 4 seconds in, 6 seconds out. Something that signals to your body that the workday is finished and the recovery phase has begun. This directly targets your diastolic baseline. Some people find a short, low-intensity walk works equally well. The form is yours to choose. The outcome, a meaningful shift toward parasympathetic dominance, is what matters. At night, protect 7 to 9 hours of sleep. Treat it as a clinical prescription because physiologically it is. If you're consistently sleeping under 6 hours, no other intervention in this protocol will deliver its full benefit. Sleep isn't recovery from the day. Sleep is when the most important cardiovascular repair work happens. That's 4 inputs: 2 targeting systolic, 2 targeting diastolic. Completely sustainable, completely evidence-based, completely within your control. Starting tonight now, I need to tell you something that applies to roughly half the people watching. Getting this wrong is the most common error I see in otherwise motivated, health-conscious people. Everything in this protocol works, but for a meaningful portion of you, these changes alone would not bring your numbers into the optimal range on their own. And if you assume they will, without continued measurement, without checking in with your physician, you're making the exact assumption that leads people to think they're fine when they aren't. 3 situations where the lifestyle protocol must be paired with medical evaluation immediately. First, if your systolic consistently reads above 1.60, lifestyle intervention alone is unlikely to move you to safe territory fast enough. A combined approach is necessary. Second, if your diastolic consistently reads above 100, the aortic wall stress we discussed is occurring right now at an accelerated rate. That warrants medical evaluation, not lifestyle optimization alone. Third, if you have any history of kidney disease, diabetes, or previous cardiovascular event, your blood pressure targets are more aggressive than general population guidelines. A reading that is high normal for someone without those conditions may be genuinely dangerous for you. Your physician needs to set your specific target number. This is not optional. This is the clinical reality for that subset of patients, and it applies regardless of how disciplined your lifestyle has become. Here's the error I most want you to avoid. You learn the protocol, you implement it, your numbers improve, and you conclude the problem is solved, so you stop measuring. Without consistent monitoring, you have no feedback system. You have no way of knowing whether the improvement held, plateaued, or reversed 3 months later. Measure your blood pressure consistently every week, same time of day, After 5 minutes of seated rest, log both numbers. That data is your dashboard. Without it, no amount of lifestyle discipline gives you the information you actually need to make good decisions. The cuff is not optional equipment. It's the feedback loop that makes everything else in this protocol meaningful. Let me leave you with this. Your blood pressure reading is a two-channel signal. One channel tells you about your heart's effort. The other tells you about your vascular recovery. Each channel speaks more loudly at different stages of life, and understanding which one to prioritize right now isn't optional. It's the difference between treating your actual risk and simply treating a number. Under 50, protect that bottom number. Manage the persistent wall stress. Give your arteries the decompression they need. Over 50, make that top number your primary focus. Keep the arteries moving. Keep the potassium coming. Keep the aerobic load consistent. Both numbers matter. Both numbers respond to how you live. The evidence on this has never been clearer, and the tools to act on it have never been more accessible. You do not need a specialist, a supplement stack, or an expensive program. You need the 4 inputs we covered today, applied consistently, measured regularly, and adjusted based on what your readings actually tell you. The window to act on them is now, not after the next reading surprises you. Quick question before you go. When you check your blood pressure, which number do you instinctively look at first, the top or the bottom? Write it in the comments. I read every single one, and your answers genuinely help me understand what to cover next. A lot of people watching right now are confused about exactly this distinction, and knowing where you stand helps me be more useful to you. And if you want to go deeper on the dietary side, specifically how to use food to move your systolic number without relying solely on medication, Winds of Thought has covered that in detail in another video. The link is in the description. If this video gave you a clearer framework than you've ever had, hit like. It helps more people find this information. And don't forget to subscribe to Winds of Thought for more evidence-based breakdowns.